The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
What is an eating disorder specifically? Eating disorders are a severe disturbance on eating in regards to eating behavior, and it's generally characterized by a recurrent worry and fear preoccupation of weight. Not only that, it's also characterized by trying to control weight in a very unhealthy fashion. One of the ones that I want to talk about today is anorexia nervosa. Notice that here we have an intense fear of gaining weight. The person may also refuse to keep a normal weight. Notice that amongst all of the individuals that suffer from anxiety disorders, notice that about 50% of persons who have been diagnosed with anorexia can also be diagnosed with depressive disorders. If I were to do a little survey here, which mental illness of all the ones that we've talked about in our previous lecture and today, which one do you think is the most lethal? Like you can die from it. How many of you say it's schizophrenia? How many of you say it's depression? You end up committing suicide and things like that. Anorexia is the most lethal mental illness. It's not depression. It's not anxiety. Most lethal mental illness is anorexia because of the fact that the person is not eating. So now we can start having organ failure. What are some of the symptoms, the physical symptoms that accompany anorexia in women because of that severe change? Notice that women can lose their menstrual cycle. Right? They won't be able to have a menstrual cycle. They won't be able to have periods anymore. Notice that because of the maladaptive eating patterns, they may start developing problems with their intestines, stomach. They may also have blood pressure, which can lead to organ failure. This individual can start developing osteoporosis because they literally don't have the nutrients that their bones need in order to sustain themselves. The problem is that because of these issues, the person can have a heart attack. The person can have a heart attack and die. Note that the vast majority of the onset of anorexia tends to occur around your late teens. So 15 to 19 years old. Let's talk about bulimia. Bulimia is characterized by excessive overeating. Later, it is followed by vomiting, fasting, laxatives, diuretics, and exercise. We have a sense strong of guilt because we have eaten excessively. Notice that compared to anorexia, it is less life-threatening, right? Because with anorexia, we didn't get any nutrients. But with bulimia, the person did get some nutrients, but the rest of them would not absorb because the person has voluntarily used diuretics or laxatives in order to vomit, urinate, or relieve themselves. Notice that people who have bulimia are more likely to seek mental health assistance. They're more likely. Notice that the main difference between bulimia and binge eating disorder is that notice that they don't necessarily have that purging and that fasting issue. Binge eating disorder is indeed more common than anorexia and bulimia. Most individuals who suffer from anorexia or eating disorders in general tend to be female, although it is prevalent in males who engage in sports. Generally, males who engage in sports, they're more preoccupied with their self-image and endurance. So maybe they engage in wanting to look slim and fit for their sports. So generally, we do see that in males as well, but generally we do see it in individuals who are more concerned with sports and self-image. Notice that there is a huge cultural component to eating disorders. Notice that eating disorders are more common in countries like this one, countries that are first world, countries that are industrial, countries that do have a surplus of food, whereas eating disorders are generally not typical. They're generally not typical in countries where food is scarce, right? That generally tends to happen in Western countries, Germany, France, here, UK. What is the etiology for eating disorders? Some people may simply be born genetically vulnerable to eating disorders. Notice that there are some personality traits that could contribute with you developing an aspect of anorexia. Generally, persons who are anorexic tend to be obsessive. They tend to be rigid in their patterns. They tend to be emotionally restrained. Notice that people who have anorexia may be geared strongly towards perfectionism, right? And that's a little bit what I was talking about, males who have anorexia, the perfect body. I want to be the best sportsman, right? I'm just going to drink this one shake and not eat. Notice that people with bulimia may be impulsive or oversensitive. Notice that cultural values have impacted. Why is it that individuals may associate thinness with being attractive? Although I argue that that's had gotten a little better. When I was a kid, that was the norm. And now we're a little bit more concerned about people being a little bit more full, right? So people being thick. So that's something that has changed a little bit. And the last thing that I want to talk about is the role of the family when it comes to eating disorders. Sometimes you don't treat the child, you treat the family. Sometimes you're going to see that in practice. Notice that generally there is a contribution from the mother's side in encouraging their children in being anorexic because they want their daughter to look a certain way or their son to look a certain way. Notice that there is a relationship between sexual trauma and physical trauma because sexual and physical trauma could have a link in the risk of developing an eating disorder. Persons who have anorexia tend to have specific cognitive factors, for example, rigid or nothing thinking. I'm either skinny or I am fat. Notice that there is a very rigid pattern. I am beautiful or I am disgusting. Right? Most people are not super beautiful and most people are not super disgusting, right? Most people are in the average. But notice that for a person who has aspects of eating disorders, they may have very rigid thinking. So any questions about that? Good deal, beautiful people.